Good morning. This is Don Taylor out of beautiful Fort Collins, Colorado. I'm going to provide some updates on my surgery, and I want to give a quick shout out to all the folks that took the time to do that on their surgeries, because for me personally, it was extremely helpful. It was motivating, it was inspiring, and most important, it gives you a view, not just what the surgery is going to be like, but for us, most importantly to me, I guess, what it's going to be like afterwards. You know, how are you going to feel? What should I expect? It just really helped. So thank you so much for that. Today is Tuesday, January 3rd, and I'm getting a surgery done by Alpine ENT, Dr. Erickson. I'm excited about it. He comes highly recommended. I've checked with a lot of people that have done work with him, and he does a great job. So I'm gonna do my very best to provide a daily update with all the key important parts that these other folks have put on for us. First of all, I got a great night's sleep. Very lucky like that. I think you have to do whatever you can to prepare your body, obviously, for the surgery you're about to get. For me, we sold a business, so I was lucky enough to work out like 5 days a week, and I know that that's not normal for people, but do whatever you can. Get some exercise, get your heart ready, get your lungs ready, get the blood flowing. And you got to get your mind right. And I did that by watching videos from other folks and having an opportunity to see what they went through so I could try to prepare my mind for what these days are going to look like afterwards. I feel great. I'm not nervous about it. I'm not anxious about it. My family's in a good spot. I'll tell you, it wasn't that way the whole time. For us, it made sense to talk about it and visit about it as a family, and just make sure that we're praying and we're all on the same page and we know what's up. So on my daily updates, I'll let you know how much I drank, and we're going to keep track of that. Staying hydrated obviously is really important, very important and hard based on where we get this done. And I'll let you know what I ate, and I'm going to track my weight on this. Kind of a bigger dude. I weighed 253 this morning. They tell me that I'm probably going to drop 20 to 30 pounds. So we'll see how that goes over the course of the first 7 days for sure. And then I'll do an update like at 2 weeks. Energy level's good now. Hopefully that's the same. Right now it's about 8:15. We're going to leave here shortly. Surgery's at 10:30. So, and in terms of what I'm getting done, a lot. So for me, it's a Uppp. So they're going to do that. They're also taking the tonsils out, which they usually do in that surgery. I've got an oversized tongue, so they're going to remove a lot of the back of my tongue as well to open that airway. Consider that when you're doing your research. Just look into it and ask. If you're going to go through all this, see if it makes sense to get that done at the same time. And then, inside my nose, they're doing 2 procedures there as well. I've got a deviated septum, and they're going to fix that and burn back the turbinates, the little soft tissue things that are kind of in the way in there, and hopefully just open up the pipes and allow me to breathe and sleep and get back to a normal life. So that's it for now. Wish me luck, keep me in prayers, and I'll give you guys an update soon.